Kernig-Brudinsky sign tests for nerve root impingement. So you want your patient lying supine, and they cup their hands behind their head, flexing it up, and they do a straight leg raise until they feel pain. Ow! And when they feel pain, they flex their knee, and that should relieve the pain. And you're good. As said, this is indicative of nerve root impingement. Lasag's test is also for nerve root impingement. You have the patient lying supine, and you passively flex their hip until they feel pain. Dropping the leg an inch or two should relieve the pain. You then dorsiflex the foot and have them lift their head, recreating the pain. So a recreation of pain would be indicative of nerve root impingement. The slump test tests for nerve pathologies such as sciatica. So you have your patient sitting on the table with their legs hanging off. They slump. You passively flex their head and extend their knee, and dorsiflex their foot. At any point in the test that they feel a recreation of pain or numbness and tingling, that would indicate a positive. SI compression and distraction tests for pathology of the SI joint. So with compression, you're going to have pain, and your patient is lying supine. You place your hands on their iliac crest and force the crests away from each other. And like I said, it would be indicative of SI pathology if they felt pain. Flip on your side. With distraction, you're doing the opposite of compression, and this should relieve the pain if they have an SI pathology. So you're forcing the iliac crest away from the SI joint, relieving their pain. The Faber's test tests for SI pathology and iliopsoas pathology. So it's called Faber's because you flex, abduct, and internally rotate. And at this point, you force the leg down, and a positive would be pain in the SI joint or the inability to abduct. The hip scouring test tests for the labrum of the hip or acetabular pathologies. So you want to abduct them and apply a force along the femur, stabilizing with your body, pushing the femur in. You want to rotate the hip. Signs and symptoms would be clicking, popping, or pain in the hip, and this would be indicative of a labral tear. Trendelenburg test tests for weak glute medius. So you want to be eye level with your patient and palpate their PSIS and tell them to stand on their affected leg. And they hold for 10 seconds. Good. And a positive would be dropping of the hip, and that would indicate a weak glute medius muscle. Ober's test tests for a tight IT band. So you have the patient lying on their side, pretty far off the table. You need to be behind them to stabilize and make sure that they don't fall off. You bring their leg back, stabilizing their body with your hip, and slowly let their leg adduct. You can turn it into a stretch by forcing their leg down, stretching the IT band. But the inability to adduct the leg itself would be a positive, and it would be indicative of a tight IT band. Our test tests for pathology of the spondy. So the patient's going to be standing on their affected leg, whatever side they have pain on, and you're standing to their side, ready to stabilize, and they extend their back. Good. And a positive would be pain with extension, and that would indicate a spondy pathology. The Kemp's test tests for a couple of different things. It's passive, and you have your patient cross their arms, and you rotate and extend their back. When you do that, if they have pain on the side of rotation, it would indicate a facet pathology. But when you rotate them and extend them and they have pain on the opposite side, it would be a muscular problem.